Type 2 diabetes has been known as the Black Death of 21st century because it's spreading exponentially around the world and has devastating health implications. More than 100 million adults in the United States are now living with diabetes or prediabetes. Nearly 30 million Americans have diabetes and another 84 million have prediabetes, a condition that, if not treated, often leads to type 2 diabetes within 5 years. At this rate, Center for Disease Control and Prevention predicts that 1 in 3 Americans will be diabetic by 2050. Diabetes is predicted by a clear set of symptoms, but it often goes undiagnosed. The main signs of diabetes may include increased thirst and hunger, increased need to urinate, fatigue, blurred vision, and slow healing of sores. If left untreated, diabetes can cause serious health implications including heart disease, blindness, kidney failure, and lower extremity amputations. When it comes to pharmacological treatment, the first-line treatment in diabetes is metformin, and the second-line treatment includes thiazolidinediones, insulin therapy, and other specific receptor inhibitors. When it comes to risk factors, apart from environmental and genetic factors, most diabetes risk factors can be controlled. The risk factors you can control are high blood pressure, high cholesterol, and high body mass index, especially if that weight is mostly carried around the tummy. So, what's going on in the body of a diabetic that is different from the healthy body? Well, most of the food we eat is turned into glucose. Glucose is crucial to our health because it's an important source of energy for our muscles and tissues. It's also our brain's main source of fuel. Pancreas, an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our body. Imagine cell wall has a lock, and insulin as a key to unlock that door for glucose to enter the cell. When you have type 1 diabetes, your body doesn't make enough insulin, and in type 2 diabetes, your body produces enough insulin, but it can't use it as well as it should. Being overweight is strongly linked to the development of type 2 diabetes. One of the plausible explanations is the accumulation of fat inside the cells of muscles and liver, which interfere with the actions of insulin. In other words, your cells have now developed insulin resistance. The fat accumulated inside your muscle cells comes from the fat you eat. Hence, diet plays a key role in prevention and treatment of type 2 diabetes. Up to 90% of people diagnosed with diabetes are overweight. These are the people whose body mass index is greater than 25. The largest study conducted to compare the obesity rate of those following different diets concluded that meat eaters have an average BMI of 28.8. It means overweight and close to being obese. Flexitarians, people who ate meat on a weekly basis rather than daily, did better at BMI of 27.3 but were still overweight. Pesco-vegetarians or pescatarians, people who avoid all meat except fish, had an average BMI of 26.3. Even lacto-ovo-vegetarians, people who do not eat meat or fish but do eat eggs and dairy, tend to be marginally overweight, and their BMI was falling at 25.7. The only dietary group found to be ideal weight were the one who followed complete plant-based diet, whose BMI averaged 23.6. Based on a study of 89,000 Californians, flexitarians appear to cut their rate of diabetes by 28%, pescatarians by 51%, and lacto-ovo-vegetarians by 61%. On the other hand, people who followed complete plant-based diet dominated by fruits, vegetables, nuts, and whole grains appear to drop their risk of having diabetes by 78%. Whole food plant-based diet can be a great concomitant therapy when it comes to prevention and management of your diabetes. The problem is, You might have eaten this way pretty much your whole life, and probably all of your friends and family members too. You don't know how else to eat. After all, it's a whole lifestyle change. At Holistic Health Support, we partner with well-trained nutrition and health coaches who have knowledge of evidence-based whole food plant-based diet to manage chronic conditions. If you or your loved ones need help to make a transition to the evidence-based whole food plant-based diet to manage your diabetes, we can help you to find a suitable nutrition coach. All you need to do is click on the link in the description and finish the questionnaire, and we will ensure to book you a free appointment with one of our health coaches. We look forward to seeing you there. Thanks for watching.